This is Claire with Becker's Healthcare. Thank you so much for joining us for today's webinar, Reducing the Need for Contingent Labor by Leveraging Technology, Geisinger's Playbook for Transforming the Workforce. Before we begin, I'll walk us through a few quick housekeeping instructions. First, we will begin today's webinar with a presentation, and you'll have time at the end of the hour for a Q&A session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, try refreshing your browser. You can also submit any technical questions into the Q&A box at any time, and we're here to help. With that, I am so pleased to introduce today's speakers, Derek Godino, Senior Director of Nursing at Geisinger Health, and Liz Cunningham, Vice President of Workforce Solutions at AMN Healthcare. Thank you, Derek and Liz, for being here today, and I'll go ahead and turn the floor over to Liz to get us started.
Thank you. Thank you very much. Derek and I are very excited to share with you all a partnership of joint innovation demonstrating how our two companies cross paths at the right time to marry together unique workforce solutions with the right program and technology. As we walk you through our shared journey today, it's important to step through some of the more recent trends in the healthcare labor market that demonstrate the impact of alternative mixes in labor on attrition rates and hours worked. We're then going to dive into how the utilization of workforce management technologies has evolved over the past decade, and how these technology solutions have matured beyond contingent labor and VMS into a robust platform approach that supports complex labor mixes and changing needs of the health systems. I'll then toss it over to my partner, Derek, who will walk you through how he started an internal agency program from the ground up with Geisinger and the impact it has made in his organization. We'll then open it up for Q&A, so please feel free to put your questions in the Q&A section on your screen throughout. Diving into some of the current trends in the healthcare labor market. At a high level, we continue to see job openings, hires, and attrition trend toward pre-pandemic rates, with a few critical differences that I want to dive into. Job growth rate is still running above normal, where hiring is trending ahead of attrition. In March, for example, there is still a ratio of 2 job openings to 1 hire. This metric is primarily being impacted by a shift in care models and types of utilization. We are seeing hospitals concentrate their hiring in CNAs, LPNs, techs, and other aide-type positions, and those hirings are outpacing RNs and physicians. This shift may require more FTE volume, but at a lower cost, impacting that continued growth we're seeing in the hiring trends. Our assumption is that this mix shift will continue to mitigate the cost of wage inflation we have seen over the past years. Pivoting to wage inflation, the second trend we're continuing to see is that increase in wages. In February, wages in the healthcare sector saw an increase of 4.5% inflation year over year, with accelerating wage increases in non-acute spaces, specialty therapy, and physician practices. We're also continuing to see the gap close for RN rates between acute and non-acute settings, which is something we're continuing to watch to see if this increase creates even more fluidity between settings for healthcare professionals. Something Derek and I actually chatted about earlier was when we start to see this normalization, does that create different types of float pools, different types of labor mixes? So that's something, as we dive into our session today, to be thinking about what that fluidity does to some of the labor mix impacts. As we move on specifically to looking at hours worked, this is something I wanted to double click into because it speaks directly to what Derek and I are going to be speaking about today. When you look at hours worked trend, there's a direct reflection of these flexible labor models and what we're seeing the impact to the overall hours worked. So our hours worked per employee is hovering around 35 hours. First, showing the direct impact of the reduction of overtime spending that hit an all-time high during COVID. But secondly, and a newer trend, is that you're seeing an even greater dip in hours worked below pre-pandemic levels being driven by these new flexible labor models. Health systems are becoming very creative with multiple different labor mixes and schedules that appeal to various generations and working accommodations. These changes are not only impacting hours worked, but proving to be highly correlated with attrition rates, which are also at an all-time low post-pandemic. So tying these trends together, we look at the direct impact to the evolution of healthcare workforce technology. In order to accommodate these new labor models, this evolution has really changed how we think about healthcare workforce technology in this space, and we've seen very rapid improvement and changes over the last 10 plus years. If we zoom out and look 10 plus years ago, most health systems were talking to companies like mine, AMN Healthcare, about one or two types of solutions and the technology to support. We were talking about things like travel nurses and per diems. We maybe started to dabble into locums and float pools, but that was even viewed as a separate offering from contingent and per diem. We also were talking to clients about only one type of tech, typically, a VMS. And even that didn't necessarily accommodate all types of contingent labor like locum tenens, for example. Whether locums, float, travel nursing, et cetera, these were all typically separate conversations about the tech and the solutions. In addition to the decisions on the VMSs and contingent labor, CHROs and CIOs were also making other workforce technology decisions independently. Think about decisions around HRIS systems, ERPs, scheduling solutions. These all were independent discussions happening, all for the right reasons and the right outcome, but there was just not a consolidated approach on how we think about all of these solutions together. If we fast forward to a few years ago, where we started to hear from health systems that they wanted easier, more accessible ways to distribute shifts to their float pools or per diem workers, and gig apps really started popping into the market. So we had that kind of traditional VMS contingent space, but clients started to ask for things like digital staffing and gig economies, and Uber for staffing were the new hot topics. We saw VMS solutions start to evolve as well, integrating with things like scheduling solutions or these clinician-facing apps. The goal around this evolution was the right one. It was focusing on the clinician experience. How do we make finding a job easier and faster for our clinicians? As adoption boomed in these solutions, so did ideas on different ways to engage clinicians and move them into different type of labor pools, which brings us to where we are today in the evolution. If we look at the discussion now, we're seeing health systems searching for a one-stop shop, a single partner and platform for growth and innovation across all labor types that will fit into and integrate within their existing ecosystem, whether Workday, Oracle, et cetera. These single solutions are expected to accommodate all labor types, perm, per diem, locums, travel nursing, international, non-clinical, et cetera, building off of those foundational principles from the past around clinician experience, ease of use, but also prioritizing new things like data security and privacy. A point I want to call out is the importance of having a more robust platform. It's not necessarily because our health systems or our clients want to use all of these services at once. It's that they want a platform for innovation that they can grow with based on their unique circumstances, with optionality for additional solutions in the future. For example, we're seeing health systems like Derek with Geisinger, who are ahead of the curve with a robust internal agency solution in search of a tech partner for growth and scale. I've also talked to other health systems who want a more creative tiered approach to a float pool, maybe where tier 1 distribution is their internal float pool, but tier 2 might be a pre-curated contingent labor pool that looks more like traditional per diem. No health system looks alike in this new era, which is why a flexible, integrated platform that enables multiple labor mixes and solutions are all still aimed at the same objectives for health systems. 1, achieving the patient care outcomes the system's looking for. 2, finding quality candidates at an affordable cost. And 3, continuing to drive that high clinician and employee satisfaction. If we look at this evolution, AMN has evolved too. So as our health systems are pushing the envelope with new and unique staffing models, so is AMN with the introduction of a singular solution for a health system to decide what modules are needed to best accommodate their unique needs. This past year, we have launched our new platform, WorkWise, that brings together the best components of our flagship products across workforce optimization and scheduling, advanced analytics, vendor management solutions, talent engagement, and self-service. Folding all of these capabilities under a single WorkWise umbrella creates optionality for our clients to grow and innovate with ease. WorkWise encourages health systems to not think about different labor mixes in silos, but as a fluid spectrum where healthcare workers can have choice in employment that helps keep them happy and retained, all still while working within the same health system. WorkWise enables this model by supporting both internal and external labor pools in one solution, making it easier for the worker to flex with what works with their with their lifestyle, while also enabling the health system to more effectively manage cost and volume with consolidated workflows and enterprise analytics. We want a platform that enables creativity and fluidity across multiple labor mixes and is set up to support the health system's goals around employee satisfaction and attrition. In addition to these core capabilities, looking for a more robust platform solution should also bring new rigor to choosing the right partner. As more of your data or a health system's data flows across these workforce platforms, it's critical to choose a partner that prioritizes privacy and trust and upholds the highest standards like SOC 2 or NIST assessments to reduce exposure to risk. Once you've established a secure and trusted platform, ensuring the platform has integration capabilities to your internal employee management solutions is also a must-have. The days of manual data entry across multiple systems, whether onboarding, credentialing, time entry, et cetera, are gone. And looking for a partner and a solution that can grow into and with your larger ecosystem is a must. Now that we're looking at this broader platform approach, I'm truly excited to pass it over to Derek, who's actually going to talk to you about how these concepts worked in practice. Derek's a true innovator, and through his experience, you'll hear how he has taken a program from ideation into true scale. And his story of the growth of his internal agency solution will bring light to this overall story. So I'll toss it over to you, Derek.
Thanks, Liz, and good afternoon, everyone. First, I'd like to take a moment to just introduce Geisinger. We are a 10-hospital, non-for-profit healthcare organization. We have more than 130 clinics. We employ more than 27,000 employees. Of those employees, 5,200 or more are registered nurses, and we also employ as many as 1,800 physicians. In addition to that, we do have a health plan with more than 500,000 members, and both a medical school and a nursing school. We also serve over 2 million people across both central and northeastern Pennsylvania, and many of which are of the counties we support are rural. Today, I was invited to share with you all the success of our internal travel program. But before I do want to speak to some of the challenges that Liz already spoke to. Over the last several years, and really at the height of the COVID pandemic, organizations like ours struggled with recruitment. And certainly not unique to us, but we did recognize that the nursing gap would only continue to grow. In fact, one statistic shows that 30% or more of the nursing workforce is expected to retire over the next 5 to 10 years. So knowing that, as Liz had mentioned, we recognize the importance of developing many different ways in which you can be a nurse at Geisinger. So we developed what I call pathways. And with that, we have our traditional pathway, which everyone should very much be familiar with as a core recruitment for both full-time or part-time positions. We also have our internationally educated nurse program, where we directly recruit and hire in over 65 different countries. And then lastly, we have our internal travel program. Now, our program initiated in April of 2022, and we chose to do this for a variety of reasons, including not only flexibility for our existing employees, but also as a way in which we can recruit new talent to the organization. The program quickly grew to over 500 registered nurses in our program today. And in that time, we've seen an increase in staff satisfaction. We've been able to reduce turnover across the organization. In fact, our program has well below benchmark a 7% turnover rate. And the program was also intended to work as what I call a feeder program to help fill our core positions. So we encourage those traveling amongst our organization to identify a department or campus that they're most satisfied with. And we encourage them to apply to any one of the full-time or part-time opportunities. And we've been able to successfully convert as many as 60 conversions into core positions. Now, all of this was also spearheaded with an interest in reducing cost. As I mentioned, during the height of COVID, like many organizations, we too became dependent on contingent labor. And we recognize that we needed to reduce not only our dependency, but our cost of premium dollar labor spend. Since the inception of the program, we have reduced our spend by $165 million and entirely eliminated our dependency on contingent labor in the areas that we support. So that includes med-surg, OB, critical care, ED, and we also support specialty areas like interventional radiology, endoscopy, and our infusion clinics. But I think the big question is how do we get here? So when we think about where we started, much like all programs, we started with the tools and resources available to us within the organization. And that was simply Microsoft Excel. And anybody who's managed an employee population using something like Microsoft Excel knows that it is less than ideal, but it did serve us well. However, as the program continued to grow, those challenges that we faced using something as simplistic as Excel, really helped us to recognize we needed to build a software solution internally. So we had done so, and that has, again, allowed us to grow our program to where we are today. So leveraging that existing internally built program and software, we've been able to have greater visibility to our metrics, in addition to our assignment details, our needs across the organization, and really automate much of the workflow. But we have to be always thinking about future state. And that's where it takes us into our partnership with you all within AMN. We have the privilege of working with you to leverage your existing technology, including both ShiftWise and Passport. And in the time we've been working together, we've identified both these technologies as a way that we can not only continue to grow our program, but really have clear metrics and robust reporting tools that will benefit us as we continue to build our program and grow in size. So all of this to say that over the last few years with the introduction of our program, we have not only seen great success and we continue to grow, but we need to do so with a partnership like we have with you now. So on that note, Liz, I actually will turn it back to you. I think that does take us already into our Q&A, but I'll hand it back.
Thanks, Derek. If anyone has questions and wants to start putting them in the chat, Derek and I are going to start to go through and answer. I do want to call out something in particular that Derek said that I thought might be interesting. If we look at that evolution slide we were talking about, this evolution to get to where we are at with Derek and AMN and the overall program has actually taken, a lot of listening and understanding across both sides. Like I mentioned before, the uniqueness of these solutions across clients lead to unique solutions. So we've been meeting with Derek's team, I want to say probably weekly, Derek, right, for the last 6 months and really building this solution together. So his team has ideas that then we can iterate and build into the product. We have clinicians using some of our clinician-facing apps that we're getting their feedback to put into the product. So that's really where this platform play comes to fruition, is having that established foundation where you can flex those modules across the types of mix or the types of workflow you're looking for. Then layering on top the innovation from our clients, the feedback from our clinicians, it allows you to iterate and grow quickly together, which is a critical part of a solution and a platform play as you think about these different labor models. So Derek, actually, the first question is for you. I'll jump over to that question. If we have some listeners on the call that are thinking about, hey, I've heard a lot about internal agency, I've heard a lot about flexible labor programs, I've maybe had some start stops where I've done it worked with like 30 travelers and then the overhead became too much, or, I didn't have, internal stakeholder buy-in. What would you recommend from your experience are the first couple of steps that need to be taken to get that stakeholder buy-in, or, just really that initial moving that idea into action? What would you recommend to any of our listeners on here?
Absolutely. So first, you need to recognize your need, right? Understanding, you heard me mention our premium dollar labor spend. So it's important to recognize what is your spend today. Is there intent to reduce that spend? If so, then looking to these different strategies, such as an internal travel program, very well may be the solution for you and your organization. When it comes to getting the buy-in, I will be honest in that we were able to easily recognize that this was the way of the future, and we needed to embrace where the market was taking us, knowing that many nurses today were becoming more and more interested in travel nursing. So when it comes to gaining buy-in from maybe your executive leaders and others, it's really about making it known that this is where the market is going. And in order, you need to be able to embrace and shift along with the market. I mean, that's really ultimately what we have done, and in part why I think we've seen such great success.
Yeah, and Derek, if you don't mind, this is an off-the-cuff follow-up question from me, so get ready. But thinking about the internal stakeholder buy-in is important, but how did that buy-in work from your labor pool that you were trying to recruit into the program? Was that kind of immediate buy-in? How did you work through that change management on the clinician side of the house?
Mm-hmm. Yeah, so the program has always intended to recruit new external talent to the organization. So when I think about how we got the buy-in for the labor pool, we very closely mimicked what was existing in the travel market. So for example, a traditional assignment in the contingent labor market is a 13-week assignment. So we wanted to mimic that as closely as possible. So our program has 12-week assignments. They do rotate, similar to that of the domestic market. It is based on any one of our platforms that we have a need. So you can travel anywhere between, as I mentioned, central and northeastern Pennsylvania. So it gives insight into what that travel requirement would look like. So making it clear that this will afford you the lifestyle that you've become accustomed to if already working in the travel market, and that it will not differentiate that much from what you have experienced in the past. You know, that's one way in which I think we were able to easily encourage recruitment from existing domestic travelers. And then as for our existing employee pool, we've had a very small number of employees who chose to join our internal travel program, which was intentional. This was not intended to be a program where members of our existing teams would leave the full-time or part-time positions they're in today to join our program. It really was about developing a program that would allow us to recruit, as I said, new talent to the organization.
Great, thanks, Derek. I'll give you a break and ask myself a question real quick, and then I'll toss it back to you. But there's some questions coming in around, looking for, or how do you decide what technology solutions best fit some of these new flexible models? I'll give my opinion, but Derek, as the buyer, feel free to jump in too. But I think it's around looking for a platform and a partner that allows for optionality. I know that sounds vague, but I do think it's important to not, solution yourself into a box that maybe doesn't fit you in a year from now or in 5 years from now. I think what we learned, most with COVID is that rapid development and rapid evolution for technology to meet the needs of the health system is critical. So, today Derek's program is thriving, and I guarantee you it will continue to thrive. But say, maybe there's an acquisition that Geisinger that happens, next year, or a new wing that gets started, and Derek needs all of a sudden, 100 per diem nurses or 20 international folks to fill a need quickly. We want him to be able to have the different levers within our technology and our program to meet his needs. So that is, my interpretation of what I'm seeing. But Derek, do you concur or push back on me if you have any, alternate opinions too?
No, absolutely. I could only echo what you've already said. It really is about having core flexible staffing. And that's really what you're speaking to, is having that greater flexibility, but also insight into your true needs, right? Understanding if we were to stand up a new tower, for example, recognizing what those needs are and how we can leverage our resources to meet those needs, and using the technology that you outlined will allow us to do that.
Yeah, agreed. And then, I called out some other things around information security, data, privacy. Like, those are also really standards that you all should be looking for in a partner when you're looking for a platform, especially because these platforms are being integrated into systems that have, very sensitive information like ERPs or EHRs. So just really making sure that a partner in technology you choose has the same rigor and standards you uphold for your own internal technology is also critical. Okay, Derek, there's a lot of questions around very specifics, and I think more in general, it's about, thinking about this program in comparison to maybe the external travel pools. I know you have external, or you have contingent labor traditional, and then you have your internal agency. So just, grouping a couple of questions together, how did you think about benefits and what those packages looked like against your contingent labor? This may be the first question.
Sure. So when we think about benefits, I'm assuming the question is directly asking more about things like medical benefits and what benefit packages are available to members of our internal travel team. I will say that the benefits we offer to our employees, whether they choose to join our internal travel program or whether they choose to select what we call a per diem position, those benefits remain the same. So we today offer medical benefits through our ACA guidelines, which is a federal requirement, but we do not offer additional benefits, including things like PTO, which we would all know as paid time off, or other benefits that those who apply and choose to accept a full-time or part-time position would otherwise benefit from.
Great. Thank you. And a follow-up question to that is, how do you, or I guess the question would be, do you allow for your internal travelers to float across campuses, or do they really just kind of stick with one? How do you think about the logistics of that across your multiple campuses?
Absolutely. Yep. So the internal travel program is intended to do exactly that. So the members of our team do travel across any one of our 10 campus locations. It is entirely based on where our needs sit today. So if we have a need or an open position available in any one of those 10 campus locations, then we would consider that an assignment. The team is provided their assignment typically 4 to 6 weeks in advance, and they do float or travel to each and every one of those campus locations.
Thanks, Derek. And I think this might be on this slide, but there's a specific question around, what does the percent of your contingent labor force look like now that you have this travel program in place? I don't know if you know that off the top of your head, but 5 years ago, did you have 10% utilization of contingent, and now it's 3? What does that look like for you all?
Sure. So as I said already, we have significantly reduced our dependency on contingent labor. Now, in all of the areas we support, which I've outlined, we have entirely eliminated our dependency on contingent labor. So that is at 0% today. It was not only 3 to 5 years ago. It was sitting, maybe upwards of 20%. It was, very high, just given the climate of healthcare. And then in the areas that we do not support through the use of our internal travel program, we've also been able to reduce our dependency on contingent labor. I do not have the exact percentage to share with you, but that has since reduced over the last few years. Okay,
great. Are you good with me continuing going with some questions, Derek? People want to know all about your program, so I can tell there's a lot of interest. Do you want to talk about maybe your labor environment? Do you have a union environment you have to work through? I think there's some questions around, what that looks like against maybe your core staff or your existing, internal staff.
Yes, we do have a mix of both union and non-unionized campuses or platforms. So when developing and establishing the internal travel program, we needed to do so with that in mind. So our program was developed to not impact or conflict with any of our union agreements across any one of our unionized platforms.
Okay, great. And integration with the existing staff, I think you answered that earlier, but it sounds like it's been a welcome, change, as it's an opportunity too for your internal staff to experience something more flexible.
It has been. In fact, when we deployed the program, it was with the intent to also shift the culture. When we think about contingent labor, it's not uncommon that the culture is that those joining the team are temporary. and not necessarily a long-term member of the team. With our internal travel program, we've been able to shift the culture to being that they are employees of the organization. And as employees of the organization, they better understand the culture, they become integrated into the culture, and they become integrated into the member of the team. By doing that, it's allowed not only our internal travel team to feel satisfied in their role by becoming a part of the team, but also recognizing that I very well may be working with Liz today, but in 6 months I could be working with Liz again, right? She can return to my unit and I will have the opportunity to work closely with Liz again. It gives hope and insight into our teams at the bedside to really embrace the internal traveler and encourage and welcome them.
Great. Yeah, it's like a job share, on steroids, right? Bringing the learnings across, throughout the organization. So I can only imagine that would have a really positive impact. There's a couple more questions in here around housing, actually, specifically, and like logistics. So are most of your internal travelers local? It sounds like you only have it at a couple regions. So are mostly local, or are you actually housing people and kind of sending them to regions, outside of like a 50-mile radius?
Sure. So there's two parts to that question. So the first is actually we are not entirely local for our current employee population. We have many internal travelers who join us from states as far as Texas, California, Florida. And so with that, we do have many who join us both locally and non-locally. As for housing, we do not offer housing. However, we have worked with some hotels and others in our local demographic that we've been able to secure reduced rates for members of our internal travel team or members of the Geisinger Health system. So that has been helpful when it comes to finding temporary housing for our employee population. But also, I know that we've also gone as far as offering insight into local real estate agencies and others that are able to help them to identify housing for the short term.
Great. Thanks, Derek. So some questions are popping in the chat around compliance, ongoing, orientation. I know as we worked with clients to actually set up the technology for some of these solutions, we think about setting up compliance at the unit level, at the facility level, and there's various orientation throughout. How are you doing that right now, or how does that work? And also maybe what's your vision on how you do that in the future? Is that something technology is going to play a role in? What does that look like for you?
Absolutely. So in current state, we leverage the software we've developed internally for much of our compliance and documentation. However, future state, we would look to our partnership with you all and AMN to leverage your software and your compliance. I know that within ShiftWise, there's opportunity for credentialing and other things, but we currently manage that internally within the program. And then we also look to our colleagues in credentialing within the organization, others like education, to support some of the compliance and credentialing and other items. I will say one thing we've done too that's allowed us, as we've grown the program, to make certain that competency is maintained amongst our team, is we have our internal travelers join competencies at the department level. So each year annually, we must do competencies across our organization, much like all healthcare organizations. And our internal travel team joins those competency sessions to maintain competency and demonstrate competency.
Great. So that's that's like the benefit of being the employee in addition to the traveler, right? Is you get to keep that continuing education going with the rest of the employed group. So no, that's a great solution. And I think, if we look at the technology and program offerings, something that's nice about having a single platform or a platform approach is, say you have similar credentials across your, contingent labor pool, per diem, travel, internal agency, and float, you can really manage those in a single place. And I think that's something that's really nice and something that we've seen our clients leverage to make their lives easier, right? You don't have different orientation requirements for a traveler as you do maybe for internal agency. So how can you consolidate that in a single platform, help reduce risk, consolidate documents. There's also, third-party integrations that we can supply to help validate those documents. So, there's also thinking about that consistency of what is the same across all these labor pools and how do we make that easy for you all as the client to manage, right, in the technology. So great to hear that example, Derek. Thank you. All right, I think that's it for questions, unless anything comes up last minute. But, I personally wanted to just say thank you to Derek. We've learned so much from him and his organization on what they've been doing with their internal agency. And it's really pushed the envelope for us at AMN with our WorkWise technology stack, thinking about the clinician experience and what we can add into the tech to continue to allow health systems to scale and support their innovation. So Derek, I want to thank you for your partnership and also thank you for sharing your story with us. And we look forward to hearing future questions from you all soon. So Claire, I think I'll turn it over to you to close out.
Yes, well, that is all the time that we have for today, but I'd like to thank Derek and Liz for such an excellent presentation, and I'd like to thank AMN Healthcare for sponsoring the webinar today. Thank you, everyone, for joining us, and we hope you have a wonderful rest of your day. Thank you so much.